Hi, my name is Brittany. I'm going to be doing my head to toe checkoff. Here, I'm just going to show my sheet. And then here are the supplies that we're going to use. And then just a quick glance around the room that all the boards are clean. Okay. Come in. Hi, my name is Brittany Sidorsky. I'm going to be your student nurse today. Can I ask you what your name is?
Mary Ramses.
All right, hello, Mary. I'm just going to start by asking you a couple of questions. Do you know where we're at?
Saginaw Valley Science East.
All right, can you tell me what year it is?
2021.
All right, your A&O times 3, which is very good. That's what we want. I'm going to start the head to toe assessment off by just asking you a couple questions about yourself and your history. Do you have any allergies?
I do not.
All right, can you tell me your date of birth?
Excuse me, November 1st, 2001.
Oh, okay. Do you have any medical diagnosis that I need to worry about?
No.
All right, are you on any medications? Like herbal substances, vitamins, minerals?
I don't take any medications, but I do take iron.
All right, can I ask you why you take iron?
I just donate blood on a pretty regular basis, so just to be safe, I take it.
Oh, okay. And Mary, do you drink alcohol?
Not very frequently, no.
No? Okay. When you do, how often would you say a month you drink?
Once a month.
Okay. And then also, do you use any tobacco products now or in the past?
No, never.
Any recreational, non-recreational drug use?
Nope.
All right. Any past hospitalizations or surgeries?
No.
All right. And can you tell me what your diet would look like in a day?
So it's usually in the morning eggs or something like yogurt. Lunch is usually like a sandwich or something like that, quesadilla, and then carrots or pretzels for a snack. And dinner is usually protein like chicken, usually a white meat, and then 2 vegetables. So pretty healthy.
Okay. And how much would you say you exercise in a week?
Not very frequently, maybe like twice, just like walking or so.
Okay. All right. Before we start, I'm gonna get your vital signs just to make sure everything is okay. I'm gonna get your temperature first.
Okay.
All right, 97.9, which is good. I'm gonna get a blood pressure on you. Is it okay if I use this arm?
Yeah. Okay.
Is that tight or good enough?
That's all good.
Okay. I'm going to put my stethoscope on, and then I'm going to feel for a brachial pulse, and then I'm going to put my stethoscope over that. All right, I'm going to use my diaphragm side of my stethoscope. I'm going to pump it up to 160. All right. All for you. All right. I got about 110 over 70. Does your blood pressure usually run low?
Yeah, it's usually on the lower side.
All right, then nothing to worry about because that's normal for you. I'm going to get a pulse on you if that is okay, radio. All right, I'm going to listen for a minute. pulse of about 80, which is good. We like to see 60 to 100. And I got a respiratory rate of about 15, which is also good. We like to see 12 to 20.
Okay.
All right, and then if I had an SpO2, I would first assess for any clubbing on the fingers, which she does not have, and then I would do capillary refill in both hands. We are wanting less than 3 seconds, which you are good. Now I'm going to start with the arms, and then I'm going to go ahead and work my way down. All right. Can you count for me? Okay. All right. We're just going to start off with some arm motions. Can you just go like this, like you're lifting weights? Can you rotate your wrists and go the other way? All right. Mary, do you know how to swim?
I do.
All right. Can you do one forward and one backward motion for me? All right. And then same thing on this side. All right. I was just feeling for any creaking or any abnormal findings, but you are all good. And now I'm gonna feel the temperature of your arms. Make sure they're okay. Everything looks good there. Now I am just going to look for any masses, moles that might be concerning, bulging, or anything like that. Have you had any trouble with this tattoo?
No, it's healed pretty well.
All right. And then I do have a few more motions I need to do. Can you hold your hands out like this? All right, I'm going to push in, you push out. All right, and now the other way. All right, and now we're going to go up and down. All right, that looks good. Can you go like this with your fingers for me? I'm playing an instrument. All right, and now can you just go like this on your lap? All right, that was just testing your cerebellum function, which looks good. Now I'm going to feel for your brachial and radial pulse. I want to feel symmetry in both pulses. All right, your radial are good. All right, and your brachial are also good. So everything looks good there. And now I'm gonna go to the head. And I'm going to start off by just looking at your scalp and making sure you don't have any masses or anything in your head. Have you ever had any head injuries?
No.
All right. I'm just going to feel it. Can you bend your head for me? All right. Everything looks good there. I'm going to brush my fingers through your hair to make sure we don't have any major clumps of hair coming out, and everything looks good. And then one last thing on the head, I just need to feel your occipital lymph node in the back of your head. Alright, everything feels good there. Now I'm just going to start off with your facial and going to test cranial nerves 5 and 7, which are your trigeminal and facial nerves. I'm going to start off, I'm just going to start off by you having to close your eyes. I'm just going to touch your face, and then can you tell me where I'm touching it?
Left cheek, right cheek, chin, forehead.
All right, very good. Can you make a smiling face for me? Sad? Mean face? Can you puff out your cheeks for me? All right, now can you punch your jaw for me? All right, everything feels good there. Now I'm just gonna go. I'm gonna feel your frontal sinuses first, and then I'm gonna go to your maxillary. All right, everything feels good there. Now I'm just going to go to your eyes, okay? I am going to first check your 6 cardinal fields of gaze, so if you could just look at my pen light and just follow it with your eyes. Oh,
Sorry.
just follow it with your eyes, you're good. Alright, everything looks good there. Now can you look at my pen light and then look at an object directly behind me? Alright, and one more time with my pen light and look directly behind me. Alright, and now I'm just going to shine my pen light quickly in your eyes to make sure they react to light. Okay, everything looks good there. And then one last thing, can can you touch your nose and then touch my pen line while looking at me? Alright, everything look good there. I just checked your cranial nerves 3, 4, and 6, which are your ocular motor, your trochlear, and your abducens. And everything looked good there. You had perla, which we like to see. Your eyes are equal, round, your pupils are round, they react to light, and they accommodate. So that's very good. Your 6 cardinal fields of gaze was good. And now I'm just going to go on to your nose. Can you just tilt your head back for me? Alright. Just going to look to see for any deviated septums or any abnormal findings in the nose. Alright, everything looked good there. And then can you close your eyes for me? Alright, I'm going to put this smell by your nose, and can you just tell me what it is?
Peppermint.
Alright, good job. That was testing your cranial nerve number 1, which is your olfactory, which works. And now I'm going to go to the mouth. Do you have any, you have like a bad gag reflex or no?
No.
Alright, to start off, I'm going to have you open up your mouth and stick out your tongue, and then I'm going to push on your tongue with a tongue presser, and then I'm going to have you say ah while I look in your mouth. So can you say your tongue for me? Alright. Can you say ah? Everything looks good in there. 1 second here, sorry.
No worries.
Alright, I just checked your cranial nerves 9, 10, and 12. Check your vagus, your hypoglossal, your glossopharyngeal, which everything was good there. Now I'm gonna go to your ears. I see you have some piercings. Did you have any problems with those, or are they okay?
They're all healed now.
Okay. I'm just gonna feel your ears. Alright. Everything looks good there. And then if I had an otoscope, I would look in to make sure that her tympanic membrane is gray, shiny, and intact. And now I'm just going to feel some lymph nodes. I'm going to feel for your post-auricular, and then your pre-auricular in front of the ear, and then your submandible, and your submental, and everything feels good. And I'm going to go down your cervical chain, make sure I'm not feeling anything. Alright, and now can you shorten your shoulders for me? I'm going to check your supraclavicular. Alright, everything seems to be good there. While also doing that, I checked cranial nerve, your spinal accessory, which is cranial nerve 11. And then I'm just going to give you a little pinch on the clavicle. Just make sure that you're hydrated. I don't see any tenting. Alright, everything looks good there. I do need to check your trachea for symmetry though. Alright, everything looks normal there. Can I have you spin around for me? I'm just gonna check my paper one time, well, to make sure that I did everything. Okay, I did miss something, so I do need to go back to that real quick before I turn around. I just need to feel your carotid artery. I need to do one at a time. Alright, and then I'm going to listen real fast with my bell because I don't want to hear any swishing. Can you hold your breath for me? Alright, everything looks good there, sounding good. Alright, now can I have you turn around for me? Yeah. Okay. I am first going to feel your thyroid, and I'm going to push it to the side, and then I'm going to have you swallow. Can you swallow for me? Alright, can you swallow again? Alright, everything looked good there. Now I'm going to check your ratio, just make sure you're not barrel chested. Alright, 2 to 1, which is the ratio that we want. And now can I just have you take a deep breath in for me and exhale? looks good there. And I'm going to have you pull your hair off to the side. And then I'm going to just pull these up down for a minute. Alright. I am going just to percuss your lungs. I want to hear timpani. I'm going to pull this down right here for a minute. Alright, everything sounded good there. And now I'm just going to listen with my diaphragm side, my stethoscope. Alright, when I place my stethoscope, can you take a deep breath in every time I move it? If you need a break, let me know. Alright, Mary, everything sounded good. Your lungs sounded clear. It doesn't sound like you had any fluid or anything in them. So that all sounded good. Now can I have you lay down for me? Alright, can you turn your neck for me to the side? Alright, you can turn it back. I was just checking for JVD, which is jugular vein distension, and we don't want that. And I didn't see that in you, so that was good. Now I'm just going to listen to your heart in 5 different spots with my bell and my diaphragm side. I'm going to go to this side. Okay. I'm going to go on the right side, the second intercostal space, to the aortic. Listening with my diaphragm for lobed up. And I'm going to go switch to my bell because we don't want to hear any swooshing. Alright, and now I'm going to go across to the other side, and then the sternal border, the second intercostal space as well to the pulmonic. Alright, now switching to my bell. Alright, and then I'm going to move down to the third intercostal space, to the herbs, listening with my diaphragm first. Alright, I'm switching to my bell. And I'm going to go down one more to the fourth intercostal space, to the tricuspid. Alright, let me listen with my bell. Alright, and then I have one more at the fifth intercostal space, and it's down here, so can you please lift up your breast tissue for me? I'm going to listen with my bell, and then, my diaphragm, and then my bell. Alright, don't hear anything with my bell. Now I'm going to listen for a full minute. heart rate of about 77, which is in the normal limits, as I told you earlier. Now I'm gonna go to your GI. Have you had any problems with your belly button, Marie?
I have not.
Alright. I am just going to inspect it just to make sure there isn't no masses, bulges, lesions, just making sure it has some symmetry. Alright. I am now going to auscultate, starting in the right lower quadrant. I'm going to listen for 5 gurgling sounds. Alright, now I'm going to move up to the upper right quadrant, doing the same thing. Alright, now I'm going to move to the left upper quadrant. Alright, and then moving to the right lower quadrant. Left lower quadrant. Alright, everything sounded good there. You had one really good gurgle. And now I'm just going to percuss. I'm going to hear tympani. I'm going to just percuss 3 times in each quadrant. If you have any pain or anything, let me know. Alright, and now I'm just going to percuss over your liver to hear the liver border. I want to hear dullness when I do this. Alright, everything sounded good there. Now I'm going to just go into some light palpitations. If you have any tenderness or anything, just let me know and I'll stop.
Okay.
Alright, was everything good there?
Mm-hmm.
Alright, now I'm going to go into some deep palpitations. Alright, did everything feel good there?
Mm-hmm.
Alright, now I am going to listen to your aortic and then your renal. I'm going to move down like this just to make sure everything's okay. I'm going to listen to my bowel side because I don't want to hear anything. Alright, and then we go to the renal. And then we go to the other side to the other renal. And then we go to the iliac. And to the other iliac. And then can I just have you bend the waist of your shorts down so I can listen to the femoral one? Alright, and the other femoral. Alright, everything sounded good there. Now I am just going to feel some more. Yeah, I need to feel your femoral for some symmetry. Alright, they both feel good. Now I am going to go to your popliteal behind your knees here. Feel for some more symmetry. Alright, that feels good. And now I'm going to go to your posterior tibialis. Alright, now I'm going to go to your dorsal pedis. Alright, everything felt good there. Now I'm just going to feel the temperature of your legs just to make sure everything's okay. Alright, temperature feels good. I'm just going to look and inspect and palpate for any edema, moles, masses, bulges, anything that could be concerning. Alright, everything looks good there. Now I am going, you can sit up now, I'm just going to check my paper one more time. I did forget one thing. I do need to do a little assessment that consists, it's called Sharper Doll, and I'm going to, can I see your finger actually, please?
Yeah.
Alright, this is sharp, and then that is doll. I'm going to have you close your eyes, and then I'm just going to poke your legs, and then you tell me if it's sharp or dull, and where in your legs I am poking you.
Okay. Sharp, right thigh.
Alright.
Dull left thigh.
Alright.
Sharp right shin. Sharp left shin. Dull upper foot. Dull upper foot. Dull lower foot. Dull lower foot.
Alright, everything looks good there, Mary. Alright, now you can get up. You can sit up, I mean. Alright, and then we're just going to do some movements with your legs, just so I can see the motion. Can you just kick them out, please, like you're kicking them off? Alright, everything looks good there. Can you, can you make your ankles go in a circle? Alright, can you go the other way? Can you wiggle your toes? Alright, I am going to check your capillary refill in your toes, just to make sure everything's okay. Alright, less than 3 seconds, so that's great. Now we're going to do the same thing that we did with the hands. I'm just going to do it with your legs. So can you push out, alright, push in, push backwards, and then push forward. Alright, everything looks great there. I don't have any concerns. Would you like me to put your shoes on? Oh, I need to check your patellar reflex real fast before we have you get up. There's a little. Alright, that was good. You had some good reflexes. Would you like me to put your shoes on, or can you put them on?
I'll put them on myself.
Alright, thank you. Yep. Alright, and then when you stand up, let me know if you get dizzy or anything. And then when you stand up, can you put your feet shoulder length apart and then your arms out like this for me?
Yeah.
Alright. Alright, now put your arms out a little bit, and now close your eyes. Alright, I was checking your acoustic cranial nerve, which is 8, which is a Romberg test, which you did tested positive for, which is great, so I have no concerns about you walking. Now, can you just walk to the corner of that table and come back for me just normally? Alright, now you can turn around, and now can you go heel to toe for me? Alright, that looks good. Your gait looks perfect. You can walk normal now. Your gait looks perfect. For her braiding scale, I would give her a 23 out of 23, which a 23 is obviously the highest that you can get. But she seems to be moving fine. She's active, and she has a pretty good diet. And while assessing her skin, there wasn't any moisture or anything, so I would give her a 23 out of 23. And then I just want to check my sheet one more time. Alright. And that's it. What did I miss? Oh,